60% of men view this act as deep intimacy and trust. Yet most couples have no idea whether swallowing semen is beneficial, harmful, or neutral for women's health. Social taboo keeps this conversation in whispers. But science has actually studied this question, and the findings reveal both surprising potential benefits and critical health risks. I'm Dr. Laura Bennett, urologist with 15 years helping people understand reproductive health. Today, I'm breaking down what research shows about seminal fluid composition, potential effects, and medical risks. This isn't judgment. This is informed medical understanding, so you can make choices based on facts, not social pressure. Now, I think we both know most doctors avoid this conversation entirely, but the science matters. So, what exactly is in semen? The first and most important thing to understand is a common misconception. It's not primarily made of sperm. In fact, sperm cells themselves make up only about 5 to 10% of total ejaculate volume. The vast majority, the other 90 to 95%, is a complex fluid called seminal plasma. This plasma isn't just a passive carrier. It's a highly sophisticated, strategically engineered biological solution, a true cocktail of substances produced by various glands in the male reproductive system. Its evolutionary purpose is singular and clear: to protect, nourish, and energize sperm on its incredibly difficult journey to fertilize an egg. Let's break down this cocktail, starting with the foundational elements. First, fructose. This simple sugar serves as the primary fuel source for sperm cells, giving them the energy required to swim. Second, proteins and enzymes. These protect sperm from the acidic environment of the female reproductive tract and help manage the fluid's consistency, allowing sperm to move freely. Third, essential minerals and vitamins, including zinc, which is crucial for sperm health and DNA stability, as well as vitamin C and B12, which act as antioxidants and support cellular function. But this is where composition moves from merely functional to truly fascinating. Beyond these life-sustaining nutrients, semen contains a powerful array of hormones and mood-altering neurochemicals, compounds identical to ones that regulate our own emotions, stress levels, and feelings of well-being. This psychoactive dimension is what makes the science so compelling. First, cortisol. This is widely known as the body's primary stress hormone. It plays a role in reducing inflammation and regulating the immune system. Second, melatonin. You probably recognize this as the sleep hormone. It's the chemical our brain releases to regulate circadian rhythms and signal when it's time to rest. Third, serotonin, one of the most famous neurotransmitters in our brain. Serotonin is often called the feel-good chemical because of its profound impact on mood, happiness, and feelings of contentment. Fourth, oxytocin, often referred to as the love hormone or bonding hormone. Oxytocin is a powerful chemical that fosters feelings of trust, intimacy, and social connection. It's the same hormone released during hugging, childbirth, and breastfeeding, playing a critical role in forming deep emotional bonds. From an evolutionary standpoint, this all makes perfect sense. This intricate cocktail is a life support system meticulously designed to ensure reproductive success. But what happens when this system is introduced to an entirely different part of the human body, like the digestive tract? Suddenly, these components are no longer just supporting sperm. They can be absorbed into the bloodstream, where they can exert influence in completely different ways. Off-label effects that have nothing to do with making a baby, but everything to do with the chemistry of the woman who ingests them. And that is where the potential for surprising benefits and hidden risks truly begins. Now that we understand the chemical makeup of semen, we can explore one of the most startling areas of research: the potential for surprising positive effects on a woman's mind and body. It's important to stress these are not guaranteed outcomes, but rather scientifically observed correlations that challenge us to think differently about this intimate act. Perhaps the most widely cited potential benefit is its proposed antidepressant effect. This idea gained significant attention following a groundbreaking 2002 study conducted at the State University of New York at Albany. Researchers surveyed nearly 300 sexually active college women, asking about their sexual practices and assessing mood using the Beck Depression Inventory, a standard clinical tool. They divided women into groups based on condom usage: those who never used condoms, those who used them sometimes, and those who always used them. The results were striking. Women who were directly exposed to their partner's semen, meaning no condom was used, reported significantly fewer depressive symptoms and demonstrated overall higher levels of happiness compared to those in the other groups. The leading hypothesis to explain this correlation points directly back to the psychoactive cocktail we just discussed. The theory is that mood elevating compounds in semen, such as serotonin, oxytocin, and endorphins, are absorbed through the lining of the digestive tract and enter the bloodstream. Once circulating throughout the body, these hormones and neurotransmitters can exert a systemic antidepressant like influence, contributing to greater sense of well being. This suggests the emotional lift experienced after intimacy might not be purely psychological, but may also have a tangible biochemical component. Beyond mood, other components could play a role in relaxation and sleep. The presence of melatonin, the body's natural sleep regulating hormone, is particularly noteworthy. While the amount is small, its ingestion could theoretically contribute to feeling of calmness and may even aid in sleep. Furthermore, oxytocin is central to the idea of emotional bonding. We know oxytocin is a powerful agent in fostering feelings of trust, empathy, and social connection. The transfer and absorption of this hormone during intimacy can be seen as a form of biochemical reinforcement, adding a biological layer to the psychological experience of closeness. One of the most profound and scientifically intriguing potential benefits relates to the immune system and pregnancy. This is centered on a concept called immunological tolerance. A woman's immune system is designed to recognize and attack foreign invaders. From a biological standpoint, a fetus is technically a foreign entity, as half of its genetic material comes from the father. In some cases, the mother's immune system can have an aggressive reaction. One of the most dangerous examples is preeclampsia, a serious pregnancy complication involving high blood pressure, thought to be linked to an adverse maternal immune response to paternal genes within the placenta. Remarkably, several studies have suggested that regular long-term exposure to a partner's semen can help build up tolerance. The idea is that by introducing the woman's body to the partner's specific proteins and DNA over time, her immune system gradually learns to recognize this genetic material as safe rather than as a threat to be attacked. Research has shown a strong correlation. Women with more prolonged sexual exposure to the father's semen before conception, including through oral ingestion, have significantly reduced risk of developing preeclampsia. This suggests the practice can act as a kind of natural immunization, preparing the body for healthy pregnancy. However, it's absolutely crucial to put these findings into perspective. These are fascinating correlations and hypotheses, not medical prescriptions. Ingesting semen is not a clinically proven treatment for depression, a substitute for sleep medication, or a guaranteed way to prevent pregnancy complications. Rather, these studies offer a compelling glimpse into subtle and powerful ways our bodies communicate. Now, while we're discussing intimacy and what creates satisfaction in relationships, there's another question couples often wonder about but rarely discuss openly. I have a video breaking down how long sex should actually last based on research. It might surprise you. Watch it after this one. All right, let's talk about the critical risks you need to understand. While the potential benefits are intriguing, it's absolutely essential to approach this topic with clear and responsible understanding of hidden risks. The same intimate act that may offer psychological benefits can also, under wrong circumstances, pose significant dangers. The most immediate and undeniable danger is transmission of sexually transmitted infections. This is the single most critical risk factor to consider. Seminal fluid is a primary vehicle for a wide range of viral and bacterial pathogens, and the delicate mucous membranes of the mouth, throat, and digestive tract are highly effective at absorbing them. It's a dangerous myth that oral sex is safe sex. Many of the most serious STIs can be transmitted just as effectively through oral contact as through genital contact. Let's be explicit about the risks. HIV. The virus that causes AIDS can be transmitted orally if there are any small cuts, sores, or inflammation in the mouth or gums, which are far more common than people realize. Herpes. Both oral HSV1 and genital HSV2 can be easily transmitted and can cause painful recurring sores. Human papillomavirus, or HPV. This is a major concern. Certain strains cause genital warts, while others are linked to significant increase in risk of developing oropharyngeal cancers. That is, cancers of the back of the throat, base of the tongue, and tonsils. Rates of these cancers have been rising, and oral HPV transmission is a primary cause. Bacterial infections. Chlamydia, gonorrhea, and syphilis can also infect the throat, leading to severe soreness, inflammation, and, if left untreated, more serious systemic health problems. A crucial and sobering fact is that many of these infections can be asymptomatic in the carrier. A partner can be infected and contagious without showing any visible signs or symptoms, making visual inspection an unreliable method of assessing risk. Beyond infectious diseases, there's another less common but serious risk: allergic reaction. This condition is known clinically as seminal plasma hypersensitivity. While rare, some individuals can have severe allergic response to specific proteins found in semen. The reaction is triggered by the immune system mistakenly identifying these proteins as harmful invaders. When ingested, symptoms can range from mild localized reactions like itching, swelling, redness, or hives in the mouth and throat to more severe systemic anaphylactic reactions. Anaphylaxis is a life-threatening condition that can cause difficulty breathing, drop in blood pressure, and requires immediate medical attention. For those with this sensitivity, the practice is not just uncomfortable, it's medically dangerous. Finally, we must consider the broader health and lifestyle of the partner. The chemical composition of semen is not static. It's a direct reflection of a person's overall health, diet, and habits. What a person consumes, their body processes, and some of those substances can end up in bodily fluids, including semen. This means toxins from excessive alcohol consumption, illicit drug use, or even high doses of certain prescription medications can potentially be present in seminal fluid. Ingesting these substances can introduce them into your own system. A healthy lifestyle, good diet, and transparency about medication are therefore not just relationship ideals, they're factors in the biological safety of this practice. The only truly effective way to mitigate these profound risks is through a foundation of absolute trust, open and honest communication about sexual health histories, and consistent regular health screenings for both partners. Without that foundation, potential for pleasure can become a problem. So, where does all of this leave us? After exploring the complex chemistry, surprising potential benefits, and very real critical risks, we arrive at a clear conclusion. The act of swallowing semen is far more significant than social taboos would have us believe. It's not merely a matter of personal taste or simple gesture of intimacy. It's a genuine biological exchange, a complex transaction of chemicals, hormones, and genetic information that can have measurable effects on everything from emotional state to fundamental workings of the immune system. We've seen how psychoactive components in this biological cocktail, the serotonin, oxytocin, melatonin, mirror the very neurochemicals that govern our mood and sense of connection. This has led to fascinating research suggesting potential mood benefits and strengthening of emotional bonds. We've explored the hypothesis that regular exposure to a partner's seminal fluid could even help prime a woman's immune system for healthier pregnancy, reducing risk of serious complications like preeclampsia. Yet, on the other side, we face undeniable risks that demand respect and caution. The threat of STIs, from HIV and herpes to cancer-causing strains of HPV, is not a remote possibility. It's a clear and present danger. We've acknowledged the rare but serious potential for allergic reactions and the fact that a partner's lifestyle and health directly impact safety of their seminal fluid. These are not minor details. They're critical counterweights in a delicate balance. Here's exactly what I want you to take away. First, this decision requires complete information. Understanding both potential benefits and serious risks allows you to make informed choices rather than acting on social pressure or assumptions. Second, trust and communication are non-negotiable. Open, honest conversations about sexual health histories and regular STI screenings for both partners are essential foundations. Third, your health and safety come first. Never feel pressured to engage in any intimate act that makes you uncomfortable or puts your health at risk. Fourth, knowledge empowers choice. By understanding the science, you can make decisions that are right for you, your body, and your relationship. Ultimately, the purpose of this exploration is not to tell you what you should or shouldn't do. It's to strip away layers of myth, shame, and misinformation and replace them with knowledge. Because true empowerment comes from understanding. It comes from having the facts, all of them, and being able to make conscious, informed, personal choices. If you found this information valuable and appreciate science based exploration of intimate health topics, hit that like button and subscribe for more evidence based content. Before you go, remember that video I mentioned about how long sex should actually last? Duration is just one piece of sexual satisfaction, and understanding what research shows might change your perspective completely. Don't skip it. I'm Dr. Laura Bennett. Thank you for watching, stay strong, and I'll see you in the next video.